Today's video will focus on the proper handling of the YUTIQ packaging and applicator. This is only a portion of the full administration process. For a step-by-step overview of the complete administration process, please visit YUTIQ.com or see the full prescribing information. Please see the indication and usage statement and important safety information at the end of this video. Proper handling of the YUTIQ packaging is necessary for successful administration. Improper opening of the pouch and improper removal of the applicator from its packaging may result in unintentionally damaging, contaminating, or dislodging the implant. It's important to note that every YUTIQ intravitreal injection procedure should be carried out under aseptic conditions. For today's purposes, let's assume the environment is sterile. Carefully open the YUTIQ carton. Do not use scissors or any sharp objects when opening the carton. The YUTIQ intravitreal injection is packaged in a sealed, sterile pouch inside a sealed Tyvek pouch. First, place the sealed Tyvek pouch on a tray and open. Then slide the Tyvek pouch off to reveal the sealed, sterile pouch within. Now, using sterile procedure, open the sterile pouch completely. Fully opening the pouch exposes the applicator in its entirety and ensures that you remove the applicator by the barrel, not the plunger. It is important not to handle the applicator by the plunger. This can cause the plunger to pull out of the internal cannula, making the applicator unusable. Next, remove the YUTIQ applicator, which is supplied with a siliconized needle, from the sterile pouch by grasping the barrel of the applicator as demonstrated here. Grasp the barrel to ensure that the plunger does not move backward, resulting in an unusable applicator. Now, with the YUTIQ applicator above the horizontal plane, remove the black stopper from the plunger. Be gentle when removing the black stopper so as not to remove or cause damage to the plunger. Carefully remove the protective cap from the siliconized needle and inspect the needle tip to ensure that it is not bent. Continue to keep the applicator tip above the horizontal plane to make sure the YUTIQ implant does not fall out. If the siliconized needle tip is not damaged or bent, remove the trombone wire. You may want to use sterile forceps to remove the trombone wire. Successful handling and removal of the YUTIQ applicator from its packaging are complete. The injection is now ready to be administered. To recap, let's walk through the do's and don'ts when removing the YUTIQ intravitreal implant from its packaging. Do use aseptic procedure. Do open sterile packaging completely, exposing the entire applicator. Do remove the applicator from the packaging, only grasping the barrel. Do always keep the applicator tip above the horizontal plane until you are ready to inject. Don't cut the carton in any way to open it. Don't partially open the sterile pouch. Don't grasp the plunger when removing the applicator from its pouch. Don't let the siliconized needle tip tilt below the horizontal plane, risking the insert to fall out. Thank you for your time and for watching this video to ensure you are prepared the next time you handle the YUTIQ intravitreal implant applicator. Remember, for more information about administration, please see the video A Guide to Administration at YUTIQ.com. Always feel free to contact your sales representative with any questions. Indications and usage. YUTIQ fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.